much. More and more women, especially women who are in midlife, have struggled with extra weight, thinning hair, and extreme moodiness. They get their thyroid levels checked, and they are within normal range, so their doctor tells them. Where our guest today says that may not be enough. Joining us is Dr. Stephen Hotze, the author of Hypothyroidism, Health and Happiness. Dr. Hotze, let's start with symptoms. Symptomatically, how does maybe an inappropriate thyroid level manifest itself?
Great question. Most commonly we hear the complaint fatigue and tiredness, but there may be a difficulty with weight and inability to sleep well, so get insomnia, brain fog, mood swings, panic attacks, anxiety attacks, maybe the depressed moods, joint muscle aches and pains, stomach disorders. Very commonly they'll have stomach disorders. They will have cold hands, cold feet, a cold body temperature. Their hair will be falling out. They'll have a large tongue, brittle fingernails, and brittle, ridging of the fingernails. So they'll also have, they'll all of a sudden become sick. They get recurrent chronic illnesses.
So, but yet there are so many women.
And irregular menstrual cycles begin to develop in women.
Okay, so they go and they have their thyroid checked,
right.
And you say that most women's levels are misdiagnosed.
Well, the reason is the way they determine, the lab determines the level. They take the last 1,000 patients, get the average, 2 standard deviations, encompasses 95% of the people. They say anybody that falls in that range is normal. That's ridiculous because the range is as tall as the Empire State Building, as wide as the Grand Canyon. You can't fall out of the range. 95% of the people always fall within the range. So that's not a good diagnosis. Your blood test doesn't tell the doctor who you are, what you look like, or what your symptoms are. So what you have to do is you have to listen to your patient, and the patient will tell you the symptoms we just described.
Now, your treatment process, though, is different. Instead of synthetic hormones, you suggest what?
I suggest using what we've used for over 100 years, natural desiccated or dried thyroid. We happen to use porcine or pork thyroid, and the reason we use it, it contains the identical hormones our body makes, both T3, the active thyroid hormone, and T4, the inactive. When a patient, if they're lucky enough to get diagnosed, will only happen 5 out of 100 times when they have thyroid. And by the way, if you have thyroid and you're a woman, guess what? You ought to be on a clinical trial to see if you improve on it. How simple is that? Rather than putting women on antidepressants and anti-anxiety and sleep medication, give them a trial and see if they get well.
Well, it's a fascinating discussion. Thank you so much. We're going to have to leave it here at the moment, but we appreciate you being here.
Glad to be here.
Now, if you'd like more information on Dr. Hotze and also his book, Hypothyroidism, Health and Happiness, all you need to do is go to our website at cbsphilly.com and click on to Talk Philly. We'll be right back.